Good afternoon, everyone. Thank you for joining us for today's REI Network webinar, The Benefits of Partnering with the Disability Community. Today's webinar is sponsored by Acorda Therapeutics, Bank of America, and Walmart. Katie Metz, Manager of Financial Empowerment and Inclusion with National Disability Institute, will be providing you with welcome introductions and some housekeeping tips.
Thanks, Elizabeth. We welcome you all today. Again, my name is Katie Metz. A little bit about my background. I joined National Disability Institute about 3 years ago. Prior to being with the National Disability Institute, I was a manager and ADA coordinator for the City of Jacksonville's Disability Services. So myself and many of our colleagues have a lot of background in the disability community, so we want to extend that knowledge to you today to talk about how do you partner with the disability community and the different programs and partnerships that you are facilitating throughout the country. Real quickly, if you're listening today to the webinar, the audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on and your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, and if you happen to accidentally close that panel, you can reopen it from the top menu item by choosing Communicate and then Join Audio Broadcast. If you don't have same capabilities on your computer and you prefer to listen by phone, you may do so by calling in on one of the phone numbers listed here through our toll-free number, 855-244-8681, or through 650-479-3207, and enter the meeting code you received on your invitation, 661-267-154. Our broadcast today is being provided closed captioning, real-time captioning. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like chat, Q&A, and/or participants. For the Q&A section of our webinar today, please use the chat box or the Q&A box to send any questions you have during the webinar to Elizabeth Jennings or Nakia Matthews, and we will direct the questions accordingly during our Q&A. If you're listening by phone and you happen to not be logged into our webinar, you can also ask questions by emailing them directly to eJennings, Jennings, @ndi-inc.org. Please do note that our webinar is being recorded and the materials will be placed on the National Disability Institute website at www.realeconomicimpact.org. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host, Nakia Matthews, or you can also email Nakia at nmatthews@ndi-inc.org. Again, we want to give a special thank you to all of our sponsors, including the Walmart Foundation, Bank of America, Acorda Therapeutics, the Brent Blatt Institute, and IRS. Without their sponsorship, we would not be able to provide webinars such as we do today. If you have not heard of National Disability Institute before, please note that NDI's work, which involves a variety of projects and initiatives funded both by private and public resources, is most recognized for harnessing the power of collaboration with government, financial institutions, business communities, nonprofits, institutions of higher education, all so that we can advance opportunities for employment and asset building for people with disabilities. As you see here, our mission we are a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities so that we can build a better economic future for Americans with disabilities. We do this through a variety of ways, one of which is through our Real Economic Impact Network, many of you who are listening today who are part of. It's an alliance of organizations and individuals dedicated to advancing the economic empowerment of people with disabilities, which consists of more than 900 partners in more than 100 cities across the United States. Again, it includes nonprofits, community tax collections, asset development organizations, financial education initiatives, corporations, private sectors, federal, local governments, agencies, and of course individuals, families with disabilities. All of these partners come together to join forces to embrace, promote, and pursue access to and inclusion of people with disabilities in the economic mainstream. So we thank you for being part of our network and joining us today. Today's agenda, we will talk about the disability community, the shared mission that we have with disability organizations, an overview of disability benefits and asset building, and then, of course, tools to support your work, finally wrapping up with Q&A. We hope today you'll turn away with attendees having a better understanding of changing attitudes within the disability community and why those changes make the timing right for valuable partnerships and increased opportunities for individuals with disabilities. Key providers within the disability community and your shared mission, as well as the basics of disability benefits and how to make connections to bridge gaps in this information, and finally with free tools to support you and the many organizations throughout the country. With that, I'm going to turn it over to my colleague, Elizabeth Jennings, who is our Director of Training and Technical Assistance for National Disability Institute in Washington, D.C., who has a great deal of knowledge, a national trainer on Social Security benefits and asset development strategies. So, Elizabeth, I turn it over to you.
Thank you so much, Katie. Good afternoon, everyone. We're so happy you were able to join us today, and I'm really thrilled to be able to talk to you about how you might do some new or additional partnering with the disability community. As Katie mentioned, I'm someone who bridges the two worlds of asset building and public benefits, and that really became my mission because I worked as a direct service provider and was consistently challenged with the fact that even though we could do a good job of securing employment for folks, there were lots of other issues that would creep in, many of them related to their financial stability. So with a good understanding of public benefits, I headed into this world of better understanding financial capability strategies and how we can blend those with what we know in the disability world to support individuals with disabilities in building a pathway out of poverty, even when they still need to hold on to one or more public benefits. One of the reasons why this is so near and dear to my heart is because of the rate of poverty that people with disabilities live. In the year 2011, an estimated 27.8% of people aged 21 to 64 that were living with a disability were living below the poverty level. That's more than 2 times the rate of their non-disabled peers, which was 12.4%. So we're talking about a huge population of people, of which almost 30% are living below the poverty level. In December of 2013, which is the most recent statistics we could get from Social Security, almost 16 million working age adults with disabilities were receiving Social Security disability benefits. Even though they receive those benefits, those individuals often lack a knowledge of the work incentives and the asset limit disregards that can help them. Instead, people typically know about the limitations of what they can earn and the limitations of what they can save and build as far as assets go, which really creates a trap that requires the person to stay poor in order to stay eligible for those critically needed public benefit and also, more importantly, the health care benefit that comes with their Social Security. Many of you on the line may know, I can see from the sign-in that some folks on the line are from the disability community, but for those who are working outside of the community, there's really a new level of focus, energy, and commitment to building a roadmap out of poverty at a national, a state, and a local level. And that energy comes from using and understanding the tools and strategies that have become available from the financial stability partners that organizations are working with. So I wanted to give you some examples of that, which I'll do in just a minute, but most of this is really generated from the fact that there's a shared mission between people who do work in the disability community and people who do work in the asset building community. Both are really striving to improve the economic self-sufficiency of low to moderate income individuals. At the end of the day, that's really the ultimate goal of both of the two communities. For the disability community, some may not know, but the drive for economic self-sufficiency for people with disabilities really stems from the Americans with Disabilities Act, which, as you can see on your screen, says that the nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency. Sometimes we get a little bit stuck in looking at equal access when we think about the ADA, but this language is really important, that part of that access was to include people having access to the services and supports that they would need to be economically self-sufficient. So this is really at the heart of why we like to do webinars like today's webinar. I know that in December we did a pretty detailed webinar on making your services or your facilities accessible. And if you missed that webinar, there's an archive available on our website. If you're not able to locate it, you can always email in to us. We'd be happy to provide it to you. But what we miss sometimes is that we're also talking about making sure people have equal opportunity and informed choice about what they can do to improve their economic self-sufficiency. And that's some of what we're going to touch upon today. I want to start off with that shared mission and some shared expectations, just so that we're all on the same page. So we believe that individuals with disabilities work and generate earned income, very important since some financial stability programs require that you have earned income to participate in the program. Individuals with disabilities manage their own money. Individuals with disabilities want to improve their financial capability. Individuals with disabilities need good credit. Sometimes what happens is that there's a fear of individuals with disabilities having access to credit, a fear that they'll be, that people will use predatory practices on them or that they will not be able to manage their credit. But we do need to believe that people with disabilities want good credit and need good credit, that they need access to loans for all of the things that the general population needs. But in addition, individuals with disabilities have gateway costs to living, and some of those gateway costs could include the need for assistive technology for which they may and likely will need to pursue a loan. Individuals with disabilities can save and build assets. Individuals with disabilities have financial goals, and individuals with disabilities are an underserved population of low-wage workers. So with those shared expectations, I want to talk a little bit about what's been happening at the federal level, how different entities are starting to work together. So we've seen out of the Department of Labor, the Employment and Training Administration provides grants to 26 states now through the Disability Employment Initiative. So disability resource coordinators in some of those states have chosen to focus on asset development, and that's targeted towards individuals with disabilities. Also, out of the Office of Disability Employment Policy through the LEAD Center, Technical Assistance Center, there is new focus on looking at how you support workforce professionals in supporting individuals with disabilities towards economic advancement. That's the language of the LEAD Center. Under the Social Security Administration, the Ticket to Work and Work and Incentives Improvement Act was designed to support people in securing employment and in having the options through suggested Medicaid buy-in programs that people could increase their earnings and their assets and maintain Medicaid coverage. But the Social Security Administration in the last few years has also added to their Ticket to Work program information for Ticket to Work holders about economic strategies, about how they can use their public benefit, their Social Security benefit, and work incentives to not only increase their earnings, but also to look at how they can improve their financial life. And if you haven't checked out any of the Social Security Administration's WISE webinars, those webinars do include information for people not only on their Social Security benefits, but also on financial capability strategies. The Centers for Medicaid and Medicare Services have self-directed services and self-directed budgets, and within those services, individuals get counseling on how to write a budget and how to maintain those budgets. And through the Substance Abuse and Mental Health Services Administration, there's PeerLink Technical Assistance Center, which is creating peer-to-peer learning around financial stability strategies. And then in addition to all of these, as many of you know, there's the new Consumer Financial Protection Bureau, which is taking a targeted focus at looking at how to support individuals with disabilities in building their financial stability. So there's all of this support from the federal offices that is providing some really great efforts at the local level, efforts that we're going to share with you and touch upon in several of NDI's webinars throughout the rest of this year. And if you're in a state where you think some of this work might be taking place, but you're not sure how to connect, or you just want to know if any of this is available in your state, you can always feel free to send us an email, and we'll be happy to look into that for you and make some connections for you. So there's all of this support from the federal level, which is trickling down through states to local level efforts, but there's still some barriers to participation and partnership that we wanted to just touch upon. So in the disability community, some of the barriers are knowledge gaps on financial stability services and supports. So in many communities, the disability community is still separate from those asset building partners, and they're still not sure about what's available, how they connect, whether or not folks want to serve the individuals with disabilities that they serve, all those kinds of little knowledge gaps. There's also myths regarding the level of risk associated with the use of financial stability tools and strategies. So keeping with our theme of Social Security benefits, there's still a lot of language that takes place that deters people who are receiving Social Security benefits and their supports and their providers from looking at increasing earnings, and particularly people shy away from building assets because they aren't aware that the Social Security Administration does disregard some assets that a person could build. Even though there is a $2,000 asset limit for people on SSI, there are asset disregards within that that can allow a person to save for specific assets, and there are work incentives that also allow people to do that. Additionally, as I mentioned, some states created Medicaid buy-in programs that may not allow a person to hold on to their Social Security benefit, but do provide a new avenue for critically needed health care benefits, Medicaid, and allow a person to have much higher levels of earnings and assets, and even disregard in some states things like 401k and other retirement savings to allow a person to save into those asset building strategies and still maintain eligibility for their Medicaid buy-in. So the disability community isn't the only one that has some knowledge gaps. The asset building community also has some gaps on access. Maybe some of these aren't as gaps as much as concerns or lack of confidence in providing disability sensitivity and an understanding of the disability service system. There's also the same fear that holds in the disability community in the asset building community, where people are really afraid of jeopardizing individuals' eligibility for disability benefits and for other benefits. So to make sure everyone on the line is aware, there's a lot of different partners within the disability service system that you can look to partner with and to help you understand some of the pieces of serving the disability population that you may not be aware of or that you may need additional support in. There's vocational rehabilitation and Division of Blind Services, and both of those entities are available in every state to support individuals with disabilities who are seeking employment. They also have flexible dollars that can help when an individual has unmet needs that are directly related to their ability to work. American Job Centers, which are available, as you all know, in every community, in every state, have been making concerted efforts over the past years to be more of a presence for individuals with disabilities that are seeking employment. The Disability Employment Initiative and its predecessor, the Disability Program Navigator Project, they have both been instrumental in helping American Job Centers across the country better understand not only how to serve individuals with disabilities, but to give data that shows that they serve a lot of people with disabilities to some very tremendous outcomes. Vocational Rehabilitation and Division of Blind Services and American Job Centers typically all participate in the Ticket to Work program. Vocational Rehabilitation is a mandated partner, but many American Job Centers are also participating. And so they serve a lot of people that receive Social Security disability benefits. So they have a lot of fingers in the sand of the disability community. There are work incentive planning and assistance grantees in every state, and they are funded by the Social Security Administration to help people who are receiving Social Security benefits understand their benefits and specifically understand how work impacts their benefits and the different kinds of work incentives they can use to increase their earnings while maintaining some or all of their disability benefit. And we're going to give you some information on how to connect with those WIPA grantees before we leave today, because they are really a critical partner anytime you want to talk about supporting individuals with disabilities in increasing their earnings and their savings and building assets, particularly for those who receive Social Security benefits. Each state has a Developmental Disabilities Council who provides funding, support, and sometimes services specifically directed to individuals with developmental disabilities. The kind of services they provide are typically training to their stakeholders and to other members of the community. They can be an excellent partner in understanding what the landscape is of a state and understanding what kind of innovation is going on directed towards individuals with developmental disabilities. In the state of Florida, we've had a long-time relationship with the Florida Developmental Disabilities Council, who has helped us spearhead work throughout the state in connecting disability organizations and asset building efforts so that they can work together to the benefit of people with disabilities. An Office of Mental Health is also available in every state. They focus on individuals with mental health needs, and they focus on all levels. So they can be looking at not only employment, but on independent living, on helping people achieve the multiple aspects of being a part of the community. Office of Mental Health can also connect you with what is very popular in the mental health community, which is peer-to-peer approach. So it's a great opportunity to connect with centers that are utilizing peer-to-peer, where you really get to do almost like a train-the-trainer model, because peers are constantly sharing with other peers the kind of supports that are available to them, their experiences in utilizing those supports, and the benefits that they're reaping because they participated. There's a state Medicaid office that can be a good connection, because sometimes housed within those Medicaid offices are some of the other entities that you're trying to reach, like folks that do waiver programs and folks that do CMS's individual budgeting. So they can be a great partner. At the local level, there's independent living centers in every corner of the country. These centers have 4 core services that they provide, but they also build on that peer-to-peer model. They focus on independent living, which, as you all know, really requires budgeting and an understanding of your personal finances. They provide advocacy. They often have resources that an individual can tap into to connect them to other disability services. So if, for example, you wanted to expand your outreach and you wanted to partner with the disability system, but you were concerned that you may not always know the right referral, an independent living center could be a really great partner, because they're skilled at understanding who in the community is doing what for individuals with disabilities, because providing great referrals is one of the core services that they offer. Every state has a protection and advocacy system, which is there to provide counsel to individuals with disabilities who are experiencing barriers that go against the ADA, or they are being denied services that they believe they should have a right to. Um, I wouldn't want you to think that they were an entity to be afraid of. In most states, they're really there to partner, to support, to provide guidance. And while some states do focus on litigation, a lot of states really focus on that second half of advocacy. And then in every state, there are local disability service providers that vary from community to community. Some of you have likely heard of the big ones, the ARC, UCP, Goodwill, Service Source. I apologize if I'm leaving anyone out who's on the line today, but there are some providers that are typically available in every community, but they really vary greatly community to community, and their level of interest and their level of understanding of what it means to partner with an asset building or a financial stability partner, and what it means to be connecting their clients to these financial stability services is also going to vary. So don't be discouraged if you reach out to one partner and they're not interested or they don't understand the value. They may not be as far along in this process of bringing together the disability world and the asset building world because it just might be new to them. And anytime you experience some of those challenges, just know that we're here to support you and to provide you some technical assistance with those instances. So some of the things that disability organizations are going to need to know from you is that you are targeting low-wage workers, that you serve individuals, not just families, that you offer financial education. Some may see that as a great first step to helping their clients understand why they would delve into this, and so that may be important to them. It would be good to know that you help the individual budget to meet their goals, that you connect people with trusted partners for credit support, that you provide or connect the individual to protected savings opportunities. This one goes back to that fear that I'm not sure I want to connect my clients with disabilities because I don't want them to jeopardize their benefits. And so if you're talking to them about saving money and building an asset, that's not going to be a great path for them because you'll jeopardize their benefits. But we're going to talk more about how that's not always the case. You also want to let them know that you don't intend to jeopardize their public benefits, that you want to work with them to understand where they see some risk, and that you are connecting with other partners like the Work Incentive Planning and Assistance or WIPA grantees so that you can do your best to do little to no harm. You want to make sure that disability organizations know that your services are free, that perhaps partnership with them at some point in the line there may be some discussion of money, but that there are many services that you offer that their clients could be referred to. And again, that the majority of your services are low risk, and we're going to talk about that more in just a minute. So I just want to give you a quick scenario. One of the challenges when in some of the lack of understanding between the two communities is that there could be really great opportunities missed for individuals. So I can tell you that I was a direct service provider, and I did talk to people about doing things, innovative things that their Social Security benefits would allow them to do. So, talk to them about using PATH plans to start businesses and things of that nature. But because I didn't yet know some of the other pieces, I didn't really know about credit, I didn't really know about protected savings opportunities, even though I knew great stuff about how to serve people with disabilities and how to talk to them that would say, what's your pie in the sky? What do you really want to do for yourself? Because I didn't understand those other pieces, I didn't know to connect somebody who wanted to start a business to folks that could provide them an IDA for business capital, or to folks that could help them better understand their credit and make sure that they were credit worthy when it came time to secure a loan. So the two communities really can work hand in hand beautifully, but it does take both sides understanding. And so these are some of the things that the disability organization is going to need to know and that you can trust. They likely don't. And if they do, then it's just a good reminder for everyone. So let's talk a little bit about these tools and strategies and what the risk might be. So one of the key things that's often talked about is the use of favorable tax provisions, and it's a key conversation right now since it's tax time. So we know that there are still individuals with disabilities who do not file their taxes and claim their earned income tax credit because they are afraid that their tax refund is going to cause a loss of their public benefit, or that if they don't spend that tax refund, that it's going to count as an asset. So fortunately, over the past few years, there have been provisions set in place to make that not true. Individuals will not have any impact on any federally funded or any public benefit that is in part funded by federal funds. They will not have any impact on their income. Let me be more clear. Their tax refund will not have any impact on their income eligibility for any federally funded public benefit, and it will not count as an asset for 12 months. So people have a very low risk in using their favorable tax provisions. That's a very low risk. Inclusive financial education is, again, another one that's really low risk. There's no risk to educating the individual about their finances, about budgeting, about all of those pieces of the pie. So this is another one that's very low risk. Producing income and preserving that income. This is one that can have moderate to high risk. It really depends on the quality of the information that the person is being given, the kind of public benefits that they're receiving, the structure of their family. So for example, if I as a mom have 2 kids and I'm getting an SSDI benefit and my 2 kids I'm also getting a benefit for my 2 kids, then the loss of my check could have a serious significant impact on our household. But if I'm someone who's receiving SSI, the rules are different for me. I have SSDI, the mom and the 2 kids, is really an all or nothing program. If I go over my earning limits, I lose all of the checks. Whereas SSI has incremental. So if I can work and earn, and the more I earn, the less of a check I'll get until I cash out. And then even then, there are other provisions to help me. And I know that all gets a little bit confusing right now, so I'm going to stop there on that, and we're going to talk about benefits in a little bit. But this is a way that this really has a moderate to high, but it can be low. It can be low with good information and connecting people to WIPAs who can help the individual understand and utilize those benefits effectively. The use of work incentives is really low to moderate. Again, those are Social Security's tools that they put in place to help people work and earn more and really test their ability to work and let Social Security know that even though they're able to work, if I didn't have these supports, I would not be able to. And we'll talk about that again in just a little bit. Credit repair is really a low risk. It allows people to fix some of their past errors, and it can be a great way for people to get themselves aligned to do stuff that even their Social Security benefits have in place for them to do, like I described with somebody who wants to start their own business. When we look at asset building, I wanted to use this moment in time to mention again that Social Security does disregard several things when it comes to assets. So something like post-secondary education and training, that's obviously low. There's really, other than the money you're putting out, you don't necessarily have to set aside money to do this. You can do it with loans. Microenterprise development, that can be low in the fact that Social Security has a work incentive to help people save money that does not count against their $2,000 limit. Home ownership, that could be moderate depending on the path the person takes. Social Security doesn't provide really any specific work incentive that allows a person to set aside funds for home ownership, except that they do allow people to deduct under SSI the money that they set aside in an IDA. So every month that can count as a deduction, which I'm going to explain again in just a minute. Sorry about that, everyone. But good to know that there are all these opportunities, even if we're not going to flesh them all out perfectly today, just because it can be overwhelming. Assistive technology is another tool that can be low. Individuals can have a loan. A loan doesn't count as income, so assistive technology loans can be a really great path to building assistive technology. And then reliable transportation. This one can be low. It really depends on how the person defines their path to that transportation. Then protected savings accounts, individual development accounts, family self-sufficiency programs, and pooled trusts can all be really low risk for individuals. It depends on how they're set up. So for many of these strategies, what's most important is how the individual's path is defined and whether or not the individual has access to and is using all of the different services that are available to them. It's really a matter of people understanding the rules and then applying them in a way that will allow the person to achieve the goal that they have designed for themselves. And it requires putting several of those rules together at once. So just for your reference, we talked about the Earned Income Tax Credit and public benefits. Here's the reference, the American Taxpayer Relief Act of 2012, that provides for people to be able to do this. All of the different tools that we talk about, we can give you references for, and we can give them to you fairly simple, such as this looks like. So if anybody is on the edge of wanting to do some innovative work that would give people a chance to utilize some of the policies that have been put in place, not only by Social Security, but by other federal offices, we'd be happy to do that for you. So asset building organizations need to know that access is paramount. If I can't access your program, it's not going to set us off on the right foot. The Social Security definition of nothing about us without us, that benefits can be a real benefit and that you don't have to be experts on this topic. So I don't want to go too deep into access because we did talk about this in December, and I'd rather refer you to that webinar. But we do have some tools on our website that we're going to share with you in just a minute. I also want to make sure you know that even though access is about making sure your program is accessible, your facility is accessible, we know that you're not going to know all of that at once. So the ADA National Network is there to assist you. The ADA National Network is a really great tool for you to use. They have a website, they have a toll-free number, and they also have a partnership with us where called Tax Access. So if you are on the line and you're a tax site specifically, you can use their online Ask Your Questions form and expedite that process. When you're chatting with the disability community, you really want to make sure you know that they go with the philosophy, nothing about us without us, and that's an important cultural aspect of the disability community. So to your best effort, you want to try to engage individuals with disabilities. It'd be great if you have hired individuals with disabilities, if you have individuals with disabilities as volunteers and as consultants. You just want to do your best effort to bring people with disabilities to the table whenever possible. It's a critically important voice for you to have as you're designing your partnerships and as you're considering how you want to move forward and what will be most effective for this population. So we've referenced benefits a few times. It was really the intent of the title of this webinar, the benefits of working with the disability community. Benefits are such a keenly important aspect of what creates a barrier to individuals. So I'm going to, just give you a quick down and dirty overview of Social Security disability benefits. And we're going to connect you to some of our previous webinars if you're interested in more information. But the Social Security Administration has two programs to support individuals with disabilities who are unable to work at a substantial level. It's the Social Security Disability Insurance Program, or SSDI, and Supplemental Security Income, which is called SSI. Now, Social Security has built into both of these programs work incentives that make it possible for individuals to test their ability to work and work at levels that allow them to maintain some or all of their cash and health care benefits. But before people return to work, they have to come onto the rolls. And when they do that, they have to prove two things to be eligible for SSDI. I apologize, it should say or for SSI. So they have to prove that they have a documented medical disability that will last 12 months or longer or result in death. And they have to prove that that disability limits their ability to engage in what's called substantial gainful activity. Substantial gainful activity is generally referred to by a dollar amount. For 2014, it's $1,070 per month for non-blind individuals, and it's $1,800 per month for blind individuals. And those numbers change every year. So let me give you a practical application of this. Everybody in the world remembers Christopher Reeves, our original Superman, or maybe not original, but the one most people remember. So Christopher Reeves incurred a disability. If you asked anybody, was Christopher Reeves disabled, they would say yes. But would he meet Social Security's definition of disability? Probably not, because while he did have a documented medical disability that lasted 12 months or longer and resulted in his death, his disability did not prevent him from working and earning money. And that's the key. It has to meet both. So this is the reason why people get so concerned about supporting individuals who are on Social Security benefits in returning to work. It's because, and working at significant levels, it's because they really had to prove that not only could the person not work, but that that work prevents them from earning what this year is $1,070 per month. So the two programs have slightly different eligibility. SSDI is for people who paid into the system. So any of you who are paying in, you are building your eligibility for SSDI benefits. It comes with Medicare, and there's some nuances in here, but what I want you to know is that SSDI has no asset limit. So sometimes people are very concerned about asset building for folks on SSDI, and while some other public benefit programs they are also participating in may have an asset limit, their SSDI does not. SSI is a bit more complex. SSI is for people that proved they have a documented disability, proved that they're not able to work at a substantial level, and also proved that they're low income. So these are folks who didn't pay enough into the system, or they're going to get some of an SSDI check and some SSI. So to qualify for SSI, you have to have monthly income less than $721 per month, and that's all of your income. And you have to have resources less than $2,000. And SSI comes with Medicaid. In some of your states, these numbers may seem off to you because your state has a state supplement, but the federal rule is that you have monthly income less than $721 per month and assets less than $2,000. I mentioned that there are work incentives available to help people return to work and maintain some or all of their benefits, and this is a quick comparison chart. You can see that the two programs are very different, but there are many work incentives available under each program to help people achieve some of their employment goals, and built within these work incentives, they also help people achieve some of their financial goals. So it would really be a tremendous amount for all of you to try to learn in an hour webinar, so we're not attempting that today. But I thought it very important for you to understand that this is where some of the barriers come in really being able to engage deeply with the disability community. Having a basic understanding of benefits is really important. So you now know that people are afraid to increase earnings and savings because they had to take the time to prove that they're not able to work and earn a substantial amount of money. And then once on the rolls, once they work and earn more money and under SSI they save more money, they become in jeopardy of losing those very benefits. So connecting people to folks that understand these work incentives is going to be not only great partnerships for you, but it's going to further serve your mission because it's going to give the individual who's receiving public benefits the kind of information they need to make some informed choices about how far they want to go with their financial goals. So work incentive and planning and assistance programs called WIPAs are SSA grantees, and they provide services to Social Security beneficiaries with a priority for people that are already at work. But they help people with making the decision to work, the effect of employment on benefits, work incentives, and really negotiating with Social Security how all of this is going to play out for the individual. There's also the protection and advocacy services, which are available in each state, and they're a great backup resource, especially if an individual is having problem accessing community services. Really, they can advocate for a person to have a better working relationship with the Social Security Administration. There's a lot that protection and advocacy can do. So some of the benefits, if you can figure out the right partnerships to help you negotiate these different pieces, is that 20% of the population, really the largest minority population in the U.S. today, are individuals with disabilities. So you're going to access a huge number of people. You're going to develop new partnerships by partnering with the disability community. You're going to position yourself to secure funding that's targeted to serving people with disabilities, and ultimately you're going to support your mission. I know this was an hour is not a lot of time, and we just touched upon the public benefit piece that I think is really so important. But we have other tools and resources on our website to help you kind of think about and understand how to put these pieces together. And we're going to provide you over the course of this year webinars from other people that are doing this. So next month we're going to have on Washington Cares, who integrates these pieces beautifully. They are providing benefits planning, they are providing financial stability, and they have a network of partners that they're working to do that with. So I want to hand over to Katie for her to share with you some of our tools and resources, and then we're going to take on some of these questions that you've asked.
Thanks, Elizabeth. And that is a lot of information. So I'm kind of run through these fairly quickly because a lot of them are available both on our website, and when you're able to go back and get the PowerPoint, you'll be able to see these tools, resources, and links to go through at your own leisure as well. So as Elizabeth mentioned, we provide a variety of tools and resources that really help our partners with improving accessibility and accommodations when it comes to persons with disabilities through a variety of ways, through network communication opportunities, education and training, providing tips on innovative ideas and education, all while working towards creating that interactive community of learning towards fostering a movement of economic empowerment for all individuals. As Elizabeth mentioned, she went over some of the highlights of understanding public benefits. For more in-depth training regarding public benefits, you're welcome to visit our website at www.realeconomicimpact.org. And once you go on our website, if you go to resources, you'll find all of our archived webinars listed there, one of which is our two-part webinar series, which Elizabeth has done many times and is really our national expert when it comes to understanding those benefits. So I encourage you to look at that recording as well as the downloadable PowerPoint, where you can go over different, what is the difference between SSI and SSDI, and a little more in-depth of many of the things that Elizabeth talked about today. Additionally, we have a webinar in that same area with regard to reaching the disability community, something similar to what we've talked about today, but this actually gives you some best practices from the field, from our partners. Many of you are either familiar with or amongst yourselves that really talks about how they have learned to effectively partner with the disability community. So again, we encourage you to download that webinar as well as the PowerPoint to learn more. When you go on our website, you'll see our virtual toolkit, which is really designed to provide our partners all over the country with easy access to a variety of tools and resources that we have made available to both our Tax Coalition VITA partners as well as additional asset development partners throughout the country. These are just a few of the highlights of the different pieces that are available with our toolkit, our disability awareness training for VITA volunteers, which is a really good overview of disability etiquette sensitivity when it comes to working with persons with disabilities, getting started with social media, outreach flyers, and different effective strategies, as well as our, more information on our tax access, which Elizabeth also spoke about earlier. When I mentioned our disability awareness training, we really heard back from our community through our REI network that this was something that they really felt was important in order to provide volunteers, site coordinators, other individuals they were working with who they knew would be working directly with the public and ensuring that their programs and services were inclusive of persons with disabilities. So we put together this disability awareness training that kind of gives the basics of both the Americans with Disabilities Act as well as what is a disability, different types of disabilities, communicating with persons with disabilities, all different types of etiquette and communication when it comes to working with the disability community. So we strongly recommend that you download this. We have it in a couple of different formats. We have it in both an e-learning course. The link is listed here. It's a self-paced course, so the individual, you can provide this link to any of your coordinators, your volunteers, anyone who might be interested in learning more about disability awareness and training. And they can log in. It's completely free. And again, it's self-paced, so they can log in and out as necessary and go ahead and finish the course. We also have a downloadable script with the PowerPoint that actually in the notes section, the entire training is scripted for anyone who might be doing, let's say you're doing a VITA training and you want to include this into the training you're already doing for your volunteers, your site coordinators. It's all there and available to you. You could also provide them with the link that we talked about earlier through the e-learning as a take-home assignment that they could finish in their own time as well. Vetted inside the disability training, we've actually included specific training for site coordinators that gives them tips on ensuring that the site is not only accessible to begin with, but continues to be accessible throughout the tax season or throughout the year if you're providing other financial capability resources to individuals. We also encourage this not only for site coordinators, but for volunteers to look through as well, because we often talk about site accessibility being everyone's mission so that we can ensure that access and accommodations are continuously provided. Here are just a few of our sample of effective strategies. A lot of these strategies were built around feedback from the field, wanting to know more about how do we work with deaf, hard of hearing? How do we reach out to the disability community? How do we make accommodations? All of those areas that people had questions about, we went ahead and put together specific strategies that you could download through our website, through the toolkit, and through that direct link listed here. Tax access, as Elizabeth mentioned earlier, is a really great opportunity for VITA volunteers, site coordinators, to reach the experts with our ADA Center partners directly in order to get answers quickly. And so we have both a flyer and information about tax access listed on our website, as well as a direct link to the tax access site, in which you can contact them both online through the link listed here. You could email questions right from their website, where you'll get a very quick answer and response. And you can also call the 1-800 number listed here, where you would speak directly to a trained ADA specialist who can give you information from them as experts. And when you do call, if you identify yourself as someone calling regarding the tax access project, you will be given priority, so you get an answer even quicker. We also wanted to talk about the inclusive environments piece of our website. So if you go to this, it really gives you some great resources on how you can build information and connect resources to support your efforts toward an inclusive environment. Once again, another great tool that you can use in reaching the disability community and ensuring access. So with that, we are going to take any questions and answers that we might have. We only have just a few minutes remaining. I don't know, Nakia or Elizabeth, if you've had any questions come in so far?
I have. So we had a question that asks, you mentioned that SSDI has no asset limit. Does that mean that a person who is on SSDI can have a savings account without fear of penalty? So the answer is, the very black and white answer is yes, but the better answer, or the more appropriate answer, is it depends. It depends on what other benefits that individual is receiving. So I've worked with individuals who the only public benefit they receive is SSDI. And in addition to their SSDI, they have a savings account, they have retirement accounts, they own a home, they have emergency savings, or they can have all those things because they're not dependent on another public benefit that doesn't allow those. I've also worked with folks who receive SSDI and receive a state Medicaid program. And they really need that state Medicaid program because it provides the supplemental health care that their Medicare is not comprehensive enough or would be too costly for them to afford. So that individual would also still be allowed to have a savings account, but they may have an asset limit. So how much they can have in that savings account would be the deterrent. But as we noted within the slides, and again, I know that it's a lot to think about, but we talk so much about access. I really wanted to take a minute for folks to understand benefits just as a barrier, but the fact that even though it's a barrier, there are a lot of rules within it that can allow for a person to participate certainly in all of the programs and services that are low risk, and you saw that there's a lot of them. But even something such as savings, there's asset disregards within the Social Security Administration's rules. There are individual development accounts, which if they receive federal funding, they do not count against any public benefit. There are pooled trusts, which are opportunities for individuals who qualify under Social Security's disability rules to participate in something that's much like a 401k, but the pooled trust is set up so that it does not count against a person's public benefits. So there are these other opportunities that exist for people. It's just really a matter of you understanding that this is a real barrier or a real perceived barrier, and understanding that your partnerships should discuss this, and they should seek to connect with WIPA grantees and other knowledgeable entities who can help both sides understand that although this does occur, there are asset limits, there are earnings limits, there are also work incentives to help people earn more, there are work incentives to help people save more, there are asset disregards, and there are protected savings opportunities. And all of the other services that are provided, free tax preparation, budgeting, credit repair, even loans, those are things that people can participate in right now. There's no risk to them. They can participate right now. So on that note, I'm gonna thank my colleague Katie Metz and thank Nakia Matthews, who's been giving us support behind the scenes on the technical side, and thank all of you for participating today. I'll pass over to Katie for one final comment.
Thanks, Elizabeth. Again, as Elizabeth said, thank you all for joining us today, and we hope that you will join us next month as well. Coming up very quickly on February 12th from 3 to 4 Eastern Standard Time, our next webinar will be on inclusive integrated service delivery, so we encourage you to certainly join us for that webinar, as well as to check out future webinars and our archive webinars, which today's webinar will be posted on our website by early next week. So once again, please join us for future and download any of those other webinars. We have great interest as well. We want to give a final thank you to our sponsors, National Disability Institute, sponsors of Walmart Foundation, Bank of America, Accorda Therapeutics, Burton Blatt, and the IRS. And finally, there are many social media outlets as well as our website to contact us and staying connected with the work that we're doing throughout the country when it comes to economic empowerment for individuals with disabilities. So with that, we thank you and hope you have a great evening.